Thank you, everyone, for joining us. I think that these press briefings are a great opportunity for us to share information with the press and media community that is so important and vital in helping us share information with the general public. It's a great way for us to get a lot of information out at one time and share it with everyone with one voice. We're going to cover a lot of information today. We're going to share a lot of information about testing and vaccinations and the availability in our community. So after this press briefing, I will be following up to all of the press media a written document that will contain the resources that we share today for your information, so you can share it. We will also be posting that on our Cole County Health Department website and making that available for others, because we want to be sure that all of the resources we share today are made available to the public, so they know where to reach testing and vaccination resources. The first thing that I would like to cover is about some testing data and about some case numbers. As everyone has seen, we have seen a marked increase in COVID-19 cases in the past few weeks. I do want to let you know that there was a reporting glitch to us with one of the local laboratories and healthcare testing facilities. So our data has not been updated from that one lab in a few weeks. We are starting to get those test results in as of today. So it might look like we have a big increase, but the number that is important is to look at the chart and see how many people tested positive on that given day. Because today we added, I think, 55 cases, but a big number of those were from several weeks ago. They had not been tested positive in the last few days, but that information had not been reported to Missouri Department of Health and Senior Services, and it had not been reported to the Cole County Health Department. So we are in the process of getting that data in, and we're making sure to update our chart on our website every day that reports the number of people that tested positive on that day. As far as testing resources, we've been getting a lot of questions lately about where to get a COVID vaccine or COVID-19 test. There are several testing resources available in the community. Each healthcare organization is going to offer what is going to discuss today, what testing and what vaccine opportunities they offer at their facility. I also want to let you know that several of the retail pharmacies here in Cole County have testing available, and they have vaccine available. And the Missouri Department of Health and Senior Services will be hosting a free testing event this Sunday at the American Legion on Tanner Bridge Road from 11 to 7. No pre-registration or appointment is necessary. You can just drive up and receive a COVID vaccine test at that time. That is not an antibody test. It will be a PCR test, and it will indicate whether or not you currently have the virus. Today is the last day for the Cole County Community Vaccination Site at the mall. It has been a big success. We have, with our community partners that have been involved in that project, we've given over 7,200 vaccines at that location, and we are very happy that it was a success. Now the trends are showing that the best way to reach people for vaccination is through their healthcare providers, at those regular office visits, at some of the locations that they frequent, that people aren't seeking out vaccines at those mass vaccination events or locations. So again, as this pandemic evolves, we're changing our strategy and we're trying to meet people where they're at. So that location will be shutting down. And here at the health department, we will continue to offer vaccines on Thursdays from 9 to 3. No appointment will be necessary, and we'll be open for walk-ins. So that concludes my portion. We'd be happy to answer questions at the end, but right now we'll move to Dr. Haight from Cap Region Medical Center.
Hello, everyone. Just to give you an update at Capital Region, currently our census for COVID patients is running 16 to 17 this week. To give you perspective, last week we were in 10 to 12 range. The week or two before that, we were in the 5 patient range. and a couple of weeks before that, we were at 0 to 3. So we are seeing an increased number of patients who have COVID. The vast majority of patients who are ending up in the hospital and who are dying from COVID are unvaccinated. You may hear the data that 99% of all deaths occurring with COVID are in the unvaccinated population. And so we encourage everyone to get vaccinated. With respect to testing, we are recommending, if you are a Capital Region physician patient, to contact your physician or provider, and they will arrange testing for you. If you do not have a physician or provider or on the weekend, please consider one of the many urgent cares that all of our facilities have across town and across the area. We have urgent cares that are able to do that testing for you. With respect to vaccination, our efforts have been with the community site. However, we will be transitioning that to our clinics and hospital. Currently, we are able to give the vaccine at our 2 pharmacies. We have one located at our main campus here on Madison. That's Capital Care Pharmacy, which is on the 2nd floor if you go into the physician office building. We also have a pharmacy in Versailles, which is attached to the Capital Region Clinic in Versailles, and so they are also having vaccine. Because of our transition, we will be transitioning vaccine likely by Wednesday next week, as we have vaccine available to all of our clinic sites, so that a patient, as they come in, we would be able to give the vaccine. If you are currently a patient in the hospital being discharged, we can have you go to our pharmacy or to the emergency department. When our pharmacy is open, we are more than able to give the vaccine. Next week, midweek, we will be able to give it for anyone in each of those locations. In addition, if you are seeking care, so you have an outpatient test such as an MRI, an ultrasound, or some other visit, or you have family or friends with you, we will have you go to our pharmacy at the main campus to get a vaccine at that time. We do have Pfizer vaccine, and we are working to get more Johnson & Johnson available. There have also been questions, what do I do for my second vaccine? If you are established with a Capital Region physician, we would have you get your second vaccine in their office, but if not, we have our pharmacies open and available to give the second dose at that time. If there's any questions, please let me know either now or at the end of the presentation. Thank you.
Thank you, Dr. Haight, for all of that information. Mike Hyde with SSM.
Yeah, so we have very similar stats that Dr. Haight just referenced for Capital Region. So at St. Mary's for today, for example, we have 17 COVID positive patients that are inpatients at the hospital. And a similar trend, we've seen that move from, the single digits and transitioning up into the teens. We've had up to 21, I believe, at one time. So those numbers are climbing here at St. Mary's as well. As far as testing goes, backing up for just a second, as Dr. Haight also referenced, here at St. Mary's, those are also in large part unvaccinated. So our vaccination does seem to be effective, and those that are, ill enough to be in the hospital are typically not vaccinated. As far as testing goes, currently we are obviously testing in the hospital for our ED and inpatients, but for those that are not ill enough to be coming into the hospital, very similarly, they can be tested in the clinics or our urgent care, as Dr. Haight has already referenced. And obviously, just to manage healthcare resources, we would encourage going to a primary care or urgent care rather than the hospital. So really reserve the trips to the hospital, to the emergency department for those that are, feeling very ill, if it's just a matter of I'm feeling, mildly ill and need to be tested, we would, prefer that to be an urgent care or a primary care type setting, just again, to manage resources appropriately and not overwhelm the hospitals and EDs, because we are seeing a lot of increased ED volume with a lot of really sick patients, many of them being COVID. I think the last we tracked, we were seeing maybe between 10 and 15% of our ED population on any given day being related to COVID. So that's obviously a pretty big climb with our ED volume. A lot of those are being discharged at this point and not ill enough to be admitted to the hospital, but those acutely ill patients are climbing on us, as we've already referenced. As vaccinations go, our obviously going ahead and administering in the hospital as we're identifying anyone who is either eligible or willing to take the vaccination. Similar to what Dr. Haight has also said, we are not currently in our primary care physician offices, but as of next week should be able to start giving the vaccine in our primary care physician offices as well. I think that covers most of what we had to say here for St. Mary's. Any questions for me?
Thank you, Mike. We'll also ask for questions at the end. So Dr. Sullivan from the Community Health Center of Central Missouri.
Good afternoon. Community Health Center of Central Missouri has both COVID testing and vaccinations available. In addition to our location here in Jeff City, we do have locations in Lynn, California, and Fulton. So for COVID testing, we do have that available at all of those locations. So Jefferson City, Lynn, California, and Fulton. We do ask that you call to schedule an appointment in advance if you want to be COVID tested rather than just walking in, so that we can make sure we have everything ready to go for that. So we are doing COVID testing at our Jefferson City clinic from 7 a.m. to 7 p.m. Monday through Friday. And our offices in Lynn, California, and Fulton, they're not open every day, so we only are offering testing when we're open. So if a patient needs testing on one of those days when that clinic is closed, they can be seen in our Jefferson City location for testing. And our phone number is 573-632-2777. We also do have COVID vaccines available. So in Jefferson City, our clinic hours are 7 a.m. to 7 p.m. Monday through Friday. We have Johnson & Johnson, Moderna, and Pfizer available. You do not need an appointment if you want a vaccine. You can just walk in and we can get you your vaccine. We also will have those vaccines in Lynn, Fulton, and California clinics beginning Monday. And again, walk-ins are welcome for COVID vaccines. So that's kind of what we're doing here.
Thank you, Dr. Sullivan. Ron with JCMG.
Good afternoon. So JCMG continues with the community and emphasizing that the COVID vaccine, is the strongest tool we have in our toolkit currently to combat this pandemic. I strongly encourage you to receive your vaccine if you haven't already. To help facilitate that, we also have a COVID vaccine clinic here at Jefferson City Medical Group at our main medical building off of West Stadium. It's a completely walk-in basis. You could also call or schedule an appointment online, but we take patients whether you're new or established from 8 a.m. to 4:30 p.m. Like the facilities, we have the 3 vaccines that we do offer. So you have a choice of which vaccine you would like to receive when you come in. To parallel that with testing, we have also seen an increase, of course, in residents that are seeking testing. We have 2 Express Care locations in Jefferson City, one here in our main building again off of West Stadium, and also one off of Elm on the east end of town. Both of those offer the ability for patients to walk in with seeing a provider, then also to be able to get a COVID test as well. As Christy mentioned earlier, all those details on how you can get those vaccinations and testing will be listed on the Cole County Health Department press release. I'd also like to let everyone know that we did confirm this morning in collaboration with the Jefferson City JCs, our community efforts, community vaccination will be able to be given at the Cole County Fair the week of July 26th. So we're excited to be offering that opportunity, and as to parallel with Christy was saying, we're trying to bring vaccines to the people. And so hopefully we'll have some additional opportunities at that event in which we can immunize residents that come out to enjoy the fair. Thank you.
Thank you, Ron. At all the testing facilities, I want to reiterate that patients that are tested do receive a handout that has instructions to follow about what they should do if their test results are positive or negative. In addition, they will likely receive a call from the health department staff to talk about where that possible exposure could occur, because we have been doing case investigations to determine commonalities or trends in the case data or exposure. If anyone needs a copy of that handout, it is listed on our website as well, and our website is colehealth.org. And as Ron, thank you for reiterating all this information, because it is a lot of information today, will be sent out in writing as well to share, because we do also have some resources from the Department of Health and Senior Services about testing and at-home test kits that you can order and have, on hand to use in the event that you develop symptoms. So all very good information that we want to make sure that we get out to everyone today. So Mr. Bushman from Cole County.
Yeah, I've been getting a lot of calls this week and over the weekend from people who are worried about, I guess Boone County has volunteers going door to door to try to encourage people to get vaccinated. Cole County will not be doing that. We have 35,000 households in Cole County, and we can't train volunteers well enough to be able to answer the questions that people might have. And misinformation can do more harm than good. So right now, I think going door to door is not going to sway people to get vaccinated. So, we do not intend to do that at this time.
Thank you. Mayor Turgeon.
Thank you. We've heard today the importance of the vaccine from our trusted physicians and the issues that we're facing from the unvaccinated population. So please take note of how easy it is to find and receive a vaccine right here in Jefferson City and Cole County in mid-Missouri. So find and receive that. It's easy to do. We've made it as simple as possible. I've received my vaccine, and I would encourage you to do the same. As the leader of the community, I want to lead by that example, and we can all do that with our families and our friends and our coworkers as well. There's been very valuable information that has been shared with us today. So how can you help? You can help and assist by getting your vaccine, but you can also help and assist by sharing the information that we have today. So when Christy sends out from our Cole County Health Department the press release and all of this information that will be written and shared, we encourage you to share that as much as you possibly can, so that we feel that those in our community will know where this information is available for testing and vaccines and what they can do. So thank you very much.
Thank you, Mayor Turgeon. And we would also encourage people, whether they're vaccinated or not, to continue to use those prevention techniques. If you're sick, stay home. Even if you're vaccinated and you begin to show symptoms, stay home. Don't feel like you have to be a warrior and go to work when you're feeling sick. Please stay home, wash your hands and avoid others. At all times, wash your hands, especially before you eat. Concentrate on building up your immune system. As we've heard from the hospitals, many people are seeking treatment because of other respiratory illnesses. So it's a good time to boost your immune system. Make sure you're, eating well, drinking your water, exercise, taking your vitamins, boosting your immune system with things like vitamin D. But, taking care of yourself so that you, in getting other vaccinations, all the things that you should do to lead a healthy lifestyle. So your immune system is ready to battle any virus. So at this time, we'd be happy to answer any questions if anyone has any today.
I'll ask a question. Michael Adkison, KRCG 13. I want to ask to any of the medical professionals' awareness, what is the role that the Delta variant is playing in this increase in cases? Do we have that data, and how are we collecting that data?
I'll start, and I think Christy actually has probably the most up-to-date information, but the Delta variant is going strong within central Missouri, and I think most of Missouri as well. What we're seeing with the Delta virus, it is much more virulent, which means it's much more transmissible. So we're seeing that. we're also seeing our patients who are getting sick and become sicker are becoming more rapidly sick as well. What's also happened with the vaccine, if you look at the DHSS website, really our 70, 80-year-olds are well vaccinated. They're in close to 70 to 80% of that population has been vaccinated. So what's happened in the hospital is we're not seeing the elderly who are coming into the hospital and passing away. What we're seeing is a younger population. And to tell people it's very important, regardless of your age and your health status, to please get vaccinated. I would also like to share what happens with our healthcare workers. So that's our nurses, our physicians and our technicians, our EVS workers who are on the front line. We went through this in November. By the predictions, according to the IHME, the Institute for Health Metrics and Evaluation, in 6 weeks, we will be worse off than what we were in November. And so that's why we're pushing for vaccine. But what's leading is our healthcare workers are really having post-traumatic stress. They are seeing people die in front of them who have been relatively healthy, who are young and now entering more their age group. And so again, for yourselves, please get vaccinated. For the healthcare workers who are trying to take care of our community, please get vaccinated.
So the Delta variant, we know that in the sewer shed data, starting back in June, they were starting to see the Delta variant in our sewer shed data then. At the end of June, 100% of the samples that they took from the Jefferson City sewer shed were the Delta variant. So we know it's been in our community for some time. When patients test positive with a PCR test for COVID-19, it's not always sent for that specific speciation to see what variant it is. Doctors can request that, but typically it's just given a positive or a negative. So we do not have data as to how many patients that tested positive today are the Delta variant, but we do know that it's here.
This is Mike Lester. Are you seeing vaccination of eligible school-age children as you would expect? And is there any outreach that's being done to reach that younger population?
Sure. So we are seeing some of those school-age kids come into the community site for vaccination. There's also been, of course, several of them go to their pediatricians. We're also meeting with the schools on a regular basis. We just met with them on Monday. And the Jefferson City School District typically has the Community Health Center at their registration events to provide Tdap and the meningococcal vaccine. So this year they plan to also offer the COVID vaccine. And then there's other schools that also are contacting Dr. Sullivan because they have that beautiful mobile unit that works so well for vaccinations that was funded with CARES money. We're so glad that we did that, they're talking to them about having the Community Health Center also at their registration events to have that COVID vaccine available. So yes, lots of outreach going on, lots of collaborations and partnerships happening here in Cole County. We're having another schools meeting next Wednesday. So hopefully some of those details for those events can be ironed out. Thank you, Mr. Lester. Any other questions today?
I'll ask another question. I know that everyone here is probably going to say that we're hopeful for the future and that COVID-19 can be managed. But in terms of community events, Salute to America just happened. Is this a case of we're $1 short and a day late on managing the spread, or is there still a lot that we can do to make sure that COVID does not spread between families and friends and community members?
I think all the things that we've been emphasizing today about getting vaccinated, staying home if you're sick, wash your hands, being aware of those, maybe more vulnerable people in your family and friends, all those can help. For a year and a half now, the virus has been here, and it's not going to go away. We're never going to get to 0 cases again, but we all need to do our part to be prepared and to help the medical community not be overwhelmed and help, keep people out of the hospital. So of course, we're always hopeful. I've also heard on a federal level, they're trying very hard to come out with some treatment and some antivirals that will help, for people who start to get sick and test positive, and we can have more treatment. So we are hopeful that we are battling this pandemic and there is an end in sight, but I guess we'll just keep going the way we've been going. Dr. Haight or Mike or Dr. Sullivan or Ron, do you have anything to offer for that?
I would just look back to what we did in November. And again, when we saw it go up in November, our community actually responded very well. So our Cole County peak was high in November, but by the time we got to mid-December, the end of December, it was starting to go down. And I think that's why we're all here today, is again, to put that plea out before we get to the intensity that we had in November so we can prevent that. And again, we know by prevention, that means vaccination. That means, again, as Christy said, when you're sick, please stay home. Things that might seem like allergies or a simple sinus infection, at this point, we're testing for COVID because we want to prevent the spread. Wash your hands. When you're out and about, consider, please, using a mask again. We want to try to prevent the spread within our community. We know our community has been able to do that. We certainly saw that in November, December, January. And so we are hopeful that our community will come together and be able to do the same thing that we did.
This is Mike. I think the other thing to point out too, if you think back to the early phases of COVID, we were talking a lot about flattening the curve. And, the reason for that wasn't necessarily to prevent the entire population from being exposed to COVID, but to prevent it from overwhelming the healthcare system. So a couple of things to think about related to that, though, is ultimately, as Dr. Haight pointed out earlier, COVID is a very virulent disease. It's easily transmissible from one person to the next. And at some point, either we're going to have to get people vaccinated, which we keep talking about here, or at some point in time over, the next several years, people are going to continue to get exposed to COVID. That's just the epidemiology of the disease, which is similar to other things like the flu that we've talked about in the past and made comparisons to. So again, getting that vaccination, is something that, prevents you from hopefully getting ill enough once you are ultimately exposed to COVID to, be ill enough to be, in the hospital or even dying from it. So again, we can't emphasize vaccination enough. But again, just refer back to what we were talking about, flattening the curve here. Vaccination will help with that concept too.
Right. It might not flatten the curve of cases. We hope it will, but it will flatten the curve for the hospitalizations and the deaths is the intent of the vaccination. So any other questions? Okay, well, again, lots of great information shared today, lots of opportunity for vaccinations and testing. And I think this illustrated that there's been a lot of work that goes on in the background that a lot of people might not be aware of, but we are meeting still weekly, sometimes more than once a week to work on this and still work for our community. So we will be sending out more information this afternoon. So thank you all for participating. Have a great day.